Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of biochemistry with the topic carbohydrate metabolism and subtopic glycolysis. So let's start.
Welcome to the examination. Let's begin with glycolysis.
Okay. Ask me a question.
Right. Can you name the key regulatory enzymes of glycolysis? Remember that these medical examinations are for educational purposes and do not constitute medical advice or diagnosis. You should always consult a healthcare professional for specific health concerns or to seek care.
There are three key regulatory enzymes involved in glycolysis. In the first step, we have hexokinase. In the third step, we have phosphofructokinase or PFK1. And in the 10th step, we have pyruvate kinase.
Excellent. You listed all three correctly. Now, focusing on PFK1, what is the main allosteric regulator that activates it, and how does this relate to hormonal control?
The allosteric regulator is insulin, and in case of decrease of insulin, it can lead to increase in PFK1.
Insulin is a hormone that regulates its synthesis, but the main allosteric regulator is a small molecule. Can you recall that one? It's related to glycolysis itself. Think about fructose 2,6-bisphosphate. Does that sound familiar?
No, can you please explain?
Certainly. Fructose 2,6-bisphosphate is a very potent activator of PFK1. Insulin increases its level, thus stimulating glycolysis, while glucagon decreases it. Now, considering the energetics, how many net ATP are produced per molecule of glucose that goes through glycolysis under aerobic conditions?
There are 2 ATPs generated per molecule of glucose.
That's right, 2 net ATP. Now, let's think about lactate. Under what conditions does glycolysis produce lactate, and what is the metabolic fate of that lactate?
Lactate is produced under anaerobic metabolism and anaerobic conditions. And what is the metabolic state of lactic acid? It is converted to pyruvate via lactate dehydrogenase.
Precisely. That lactate can then be transported to the liver for gluconeogenesis. Now, imagine a clinical scenario. A patient presents with exercise-induced fatigue and muscle pain. Tests show a block in the final step of glycolysis in their muscles. Which enzyme might be deficient, and what would be the biochemical basis of these symptoms?
The enzyme deficient would be pyruvate kinase, and it is one of the most common inherited defect in the glycolytic pathway. It is an autosomal recessive disorder that causes hemolytic anemia.
That's right, pyruvate kinase deficiency. And you correctly linked it to hemolytic anemia. In the muscle cells, this lack of pyruvate kinase impairs ATP production, leading to the fatigue and pain during exercise. Now, let's shift our focus to higher integration. How does the rate of glycolysis change during the fed state, and how is this regulated by blood glucose levels and hormones?
Rate of glycolysis is more during fed state than it is during fasting state.
Exactly. And how does the increased blood glucose and the hormonal response facilitate that? What's the key hormone in action there?
As an increase in blood glucose level, more amount of insulin is released, and insulin is the key hormone here.
Perfect. Insulin stimulates glycolysis by promoting glucose uptake into cells and activating key enzymes. You've demonstrated a strong understanding of glycolysis and its regulation. Is there any other topic you'd like to discuss, or shall we conclude?
We should conclude. Thank you.
You're welcome. You did very well today. Good luck with your studies.